Hey guys, I'm David DiMuzio.
And I'm Dodge Feeler, Dr. McGrath, nurse practitioner.
And Dodge was a big part of my procedure, which I had done yesterday. And this morning we were chatting over bagels, and there were a couple of really interesting things that he told me about the risks of performing FUE on an FUT patient, like I have been. So I've had 3 FUT procedures done to me, which means that I have these scars in the back of my head, and I've had a certain amount of donor hair already extracted from me. And Dodge, you said that lately you've been performing a lot more FUE surgeries on FUT patients like me, and that there are some kind of challenges to that. So explain what they were and what it was like performing surgery on me, and some of the challenges that you've run into on other patients doing a procedure like this on them.
So, typically somewhere between 2 and 4 strips is about the limit as far as elasticity. And so often lately we've been doing some surgeries where we can do a little more donor hair from the strips being taken. And then we'll go in with FUE and go around that area. Sometimes the issue is that, we may have a nice scar line, but underneath there may be some additional scar tissue that kind of makes it difficult to pull those grafts out or even get the hair. With your case, it was actually very easy. You had actually a ton of donor hair left, and we really had no issues at all. But it was a very big success.
So you said that in some cases you've done recently, though, that's not the case, where that scar tissue is kind of quite abundant. And so it's been very difficult to sort of go around that scar tissue and remove grafts.
Yeah, sometimes as far as 0.3 to 0.5 centimeters surrounding that scar, it's where you really can't pull any hair out. It just becomes very fibrous and difficult to pull the grafts, and it's a little difficult on the machine as well. So just in that, it's not necessarily an issue. It just kind of limits the amount of hair that we can take. But someone who's had 3 or 4 strips, they've already had a ton of donor hair taken. So if they can even get 1,000 to 1,500 more grafts, it can be a huge win and a nice icing on the cake.
Dodge, just to get your take on it, because this is something I've talked about a bit on the channel, how I had, these few 3 FUT surgeries before I had FUE. What is your take on that, and whether that was the right decision or not, and why it might or might not have been, versus if I had started with FUE or a large FUE case like I did yesterday, after these FUT surgeries?
Both surgeries have tons of benefits, and then they obviously have some issues. With your cases, I still think you made the right decision. A lot of hair was moved, at least on the 2 that we did on you. And so really, the big issue if you do strip first is, once again, potentially scar tissue, but you can always go in and do the FUE. And doing FUE, you can do this kind of the same thing, but slowly all the donor hair in a much wider area is going to be taken. So making future strips are going to be much less abundant in terms of hair and what you can get out of that.
From me looking at the pictures of my donor area, I was actually surprised, because you did 2,400 grafts. I was surprised how much donor hair was gone, like how much of that area you covered. I mean, it's like, I'll show in the pictures, but I mean, it's quite a lot of the back of my head that is like decimated, sort of, I guess, would be a way of saying it. So, I was sort of seeing that and going, wow, if I had started with this, I wouldn't have been able to do this 3 or 4 times,
Yeah. Well, and that's, with the strip, you're going in, you're taking the very best hair you can find, and then you're cutting that up and using them as grafts. Whereas with FUE, you can't be quite as decisive, because you've got to take it from a much larger area, or it will have that moth-eaten look where it really ends up not looking good at all. Whereas, with the strip, you get the nice short little strips, and then you can go in with FUE and go around, and then it still looks good. You still have plenty of donor area where it's all going to be nice coverage, and those scars are going to look better as well.
Dodge, you were saying that one of the benefits yesterday of me doing this FUE surgery was you were actually able to work on my FUT scar a little bit. So can you explain why doing an FUE surgery like this, you can actually kind of work on the scar even if you're not implanting hairs into it?
Sure. So a lot of time when we're doing FUEs with someone who's already had an FUT done, we'll actually go into the scar with our FUE device, and we'll place holes through it. We're not taking out tissue. We're not actually taking out any grafts, but we are taking out tissue. And when that happens, it'll actually retract and make that scar thinner, making it much smaller in width. and it ends up being a nice result.
Wow. So that's super cool. So during this FUE surgery, even though they're not taking grafts from my scar, they're actually making my scar smaller at the same time by sort of working the scar. So anyway, I thought that was super, super interesting. Thanks so much, Dodge, for coming to the channel today. And thank you for working on me so hard yesterday. We'll see you guys soon.